So friends, before we discuss how to set up our endoscopy equipment, we should know what is the difference between three power stabilizing devices such as a stabilizer, a CVT, also called a constant voltage transformer, and a UPS. So come on, I'll show you. So this is in our OT, the central electrical area where we have set up. This is called a CVT, where you can see it is written constant voltage transformer. The other is a UPS, which you can come here and see. So this is a UPS which is connected with batteries. The third thing is called a stabilizer, which you can see the picture in the inset. So a stabilizer you have seen normally at home, where we put it over the fridges or the old style TVs, where it is commonly used in the home, where you keep it on the fridge, for example, to stabilize the current which is getting delivered from the powerhouse. For the medical equipment, the stabilizer is not a recommended device. The difference between a stabilizer and this CVT is that a stabilizer is meant for gross correction of voltages, such as in the home setting, whereas a constant voltage transformer or a CVT, it gives a filtered linear current, so that a lot of fluctuations, power surges, etc. gets absorbed with this. But all these two devices don't provide any power backup, for which we require batteries, and this is the UPS system which provides us the backup for our OT, where if the light failure is there, the equipment can still run till the battery power is there. So first of all, we will discuss the difference between the stabilizer and the CVT. A stabilizer, like I said, is for gross voltage stabilization, and the stabilizer is not a suitable device for medical equipment. For the medical equipment which requires a large amount of current, but it requires filtered and stable current, the proper device to use is a CVT. A CVT is a constant voltage transformer which provides filtered and linear current to the medical equipment, and it is recommended to use for devices such as your SIAM or your cautery or RF machines, which take a lot of power when they work. On the other hand, this is a UPS which provides battery power, but it doesn't stabilize this battery power. It provides backup to your medical devices. Now UPS are all of three types: an offline UPS, a line interactive UPS, and an online UPS. So for medical devices, what we prefer to use is an online UPS. So what is an online UPS? They are a little more expensive than the other two varieties, but in an online UPS, the current is always charging the UPS first, and then from this battery, the power supply goes to the medical equipment. So any interference, anything first goes to the batteries, where it gets absorbed, and then it powers the medical equipment. Or on the other hand, an offline UPS, the power supply is bypassed by the batteries. They are getting charged by a different circuit, and the power supply to the medical equipment is through a different circuit. So because of this, the current or the disturbance or any fluctuation can bypass the UPS and damage your equipment. These regular computer UPS sometimes are offline UPS or line interactive UPS, and you should be aware of this fact. For medical equipment, use online UPS, where first of all the battery is charged, and then from this battery the medical equipment gets powered. So all the fluctuations, currents, or any disturbance in the line gets absorbed by the battery.